Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Depression. Clinical depression is a condition that is known by a large number of different names. Some of these names include the following: major depression, the blues, and biological depression. However, it is important to realise that whatever name is used, they are all talking about the same thing. They are not talking about anything different, and individuals who are feeling depressed or down can often feel this way for a very long time, sometimes even for decades or possibly someone's whole life. These are the types of feelings that will not simply disappear within a couple of days or even a couple of weeks. Many individuals with depression who experience these feelings will often also feel as though they do not have much energy. They will find it difficult to get their energy back up to what it once was before. Those with clinical depression also find themselves feeling incredibly hopeless, and they will even stop enjoying the things they once enjoyed before they found themselves in this condition. They will not want to get back into them for a remarkably long time. There are all kinds of depression symptoms that can come in a large number of different ways. Not only that, but all of these who have this condition will not have the same experience as other individuals with this. Everyone will be different. There are many different people who will even appear to be sadder than other people. These people often prefer to complain. They will assume that they simply cannot get going, even if they know what they can do, that they can do this. They may also not feel motivated enough to do the things that need to be done. These people will find it hard to do everyday things in life, whatever that be changing their clothes or even eating food. The everyday things end up becoming too hard for them to do. Those who know these types of people well will know that there have been a number of changes in behaviour in them. Most people are happy to assist, but many are not sure how to go about doing this. One particular well-known mental health company, known as the National Institute of Mental Health, has recently revealed to the world that children can even experience depression. It has been found that depression will usually begin as high levels of anxiety in them. In saying that, these days, the actual cause of depression has not yet been completely understood. In other words, it can come from anything and at any time in life. Many individuals with depression have described clinical depression is not the same as regular sadness. Regular sadness usually occurs when a relative or friend passes away. Clinical depression will last much longer than a couple of days and will keep going on and on. Because it goes on and on and on, it will begin to have an effect on the individual's school or work. Relationships with other people will also be affected. They will no longer be able to enjoy life in general and will even forget what it is like to simply have fun. Then there are people with this condition who will feel empty. These people will feel hopeless. Studies have shown that at least 7% of Americans will be formally diagnosed with clinical depression. It is more likely than those diagnosed with will be women rather than men. George Sciabala once said in a book he wrote that, "When I would have a serious episode of depression, everything in my life will change. It'll be a major condition that makes me want to die. I would think suicidal thoughts and would want to drop away from everything in my life. However, I believe that there is no such thing as a limited depression. The only time depression would end for somebody is if they died. This is the real meaning of severe depression. There is nothing else that can describe severe depression in any other way. The good news is that these days, depression can be cured. Whatever the case, and however bad an individual might think they are, they really can be cured. All it takes is the right kind of treatment. The good news is that most people really are cured. When it comes to depression symptoms, it is worth knowing that there are a wide range of them. It is worth getting to know what these symptoms are so that you can recognize them in yourself and in other people that you know. Grief is one such depression symptom that will usually take place when a friend or relative has passed away, but there are also forms of grief too. Perhaps a child's parents have split up and are divorced, or perhaps a couple without children have split up for good. Maybe another couple are unable to have children or have suffered from a miscarriage. Whatever the situation that has caused them grief, many will not think that this can result in depression, but in actual fact it can. Young adults who go through their normal mood swings may find themselves feeling depressed, or they may not. However, depression will often occur during these adult years. Women are more likely to get it than men. If a man does get it, they will probably keep themselves busy with a distraction or something they enjoy. They will not want to do anything else. They might also experience anger or rage that will be too hard for them to control. There are those who control their anger, and there are those who find it difficult to do this. It does not matter what they try. Trauma and anxiety can also be depression symptoms. These can come from any situation and experience in life. It is important to understand that depression symptoms will be different for everybody of all ages and of all genders. It is possible they will also swap and change as the condition drags on. A person's age and culture may also play a part in terms of depression symptoms they may face. Young adults might find themselves feeling agitated and irritable. More often than not, men will not admit to depression as women would. There may be some cultures that do all they can to hide their true feelings. They might also show them in different manners. There are also a large number of regular and well-known depression symptoms that may involve the following. A person might find themselves angry more often than what they normally are. They might also find it difficult to control their anger. They will no longer want to participate in the activities they once enjoyed in their life. The individuals may also find themselves thinking about death and want to commit suicide. They will often feel sad, overwhelmed, and find themselves crying far more often than normal. Those with depression will often feel as though they are not worthy. They will feel hopeless within themselves and assume they are hopeless at everything. Individuals will likely be finding it hard to sleep, or their sleeping patterns may change. They may not even be able to sleep at all. These people will find it hard to concentrate on all sorts of things. Their weight will change, as will the way they eat. The individual may also feel muscle pain or headaches. They will not know why these things are occurring. Those who have depression will often find it hard to deal with the stress that they may experience every day. They will think that they are the only one with this condition and will not know how to help themselves. Getting dressed, having a shower, or even getting up and out of bed will feel too hard for them to do. Many of these depression symptoms will cause these people to get and feel down very quickly. Even if they are feeling happy and positive, this will only cause them to feel negative on a regular basis. It is true that these conditions can begin to occur when an individual is feeling fearful. Shamefulness and anger can also cause depression. More often than not, these particular feelings and emotions will stay inside the body. An individual may or may not find themselves feeling nausea, aches, and a wide range of pains in various areas of the body. Weakness, tension, and irritation may begin to occur during this period. It is also normal to feel very tired and not have any relief from this. If the depression in an individual is very bad, then it is possible that the individual will not be able to even show emotion at all. It is normal for them to want to die and show behaviours of this. The good news is that it is possible to seek therapy to help with depression. Depression can easily be managed and controlled. There are times when a person who has depression will feel as though they are weak and fake. They will also think that others think that they are like that too. These people will find themselves embarrassed and afraid to deal with any consequences they may have to face, particularly when they have to tell other people and professionals they have this condition. Those with the depression will be happy to know that there are a wide range of different therapeutic methods that can be used to help them to recover. A couple of these particular therapies include psychodynamic therapy and mindfulness-based cognitive therapy. Whatever method an individual uses to help them to recover from depression, we can assure you that fully qualified therapists will assist. They will be able to do their jobs in an understanding manner. There will be no judgment involved at all, and all they focus on is curing the depression and what may have caused it. Sometimes all it takes is to just realise what is causing the depression. They will learn how to be motivated into wanting to make the necessary changes in their lives. Then there are a wide range of support groups and group therapy that are worth participating in. These have been fantastic to those who are going through depression of all kinds. These types of groups will allow and help them to work on the depression symptoms they are dealing with. They can do this with other people that have gone through this in the past. Be aware that it is normal for an individual with depression to also experience loneliness and isolation. People who have depression may find it hard to receive comfort from people around them, even if they are comfortable with those people who try to give it to them. This is because such people think that the person is not being serious about their help, or that they simply do not deserve to receive it from another person. Those who are feeling hopelessness, lethargy, and irritable all of the time will also not be able to show love to others even when they want to be able to do this. Depression is a condition that can also have a major effect on sexual intimacy and communication with all people, not just in a romantic relationship. Then there are those who might appear to be more distant than others. Others might seem like they need to depend and rely on others more, and often come across as needy. When it comes to sexual partners and their families who live with them, those with depression and those in their family would do well to have family therapy or counselling. This should be done all together. It is vital to get to know how one can assist the other person who not only has depression but also on those who do not. Also consider that there are a number of other mental health issues that could result in depression. These might include substance abuse, post-traumatic stress disorder, bipolar, and schizophrenia, among others. Substance abuse will involve alcohol and result in a person requiring depressants for their central nervous system. Some individuals might turn to drugs or alcohol to try and take care of their condition. Please understand that these things will only make the depression far worse than what it already is, not only in the immediate future but also in the long run. Breaking up from a relationship is another thing that can result in depression symptoms. A young student might find themselves studying a lot and may end up not eating much. They could find themselves avoiding their lectures and not getting much sleep. If other students are not noticing these signs in their fellow students, and they know the person has been in a relationship, please consider that it could be because of the couples have broken up with each other. It is worth suggesting to the student that they go and have an appointment with a therapist. During the therapy, the therapist will help students to come to understand that their feelings may be what their feelings may be about. Perhaps the student feels as though they have been betrayed or are feeling a sense of grief. Sometimes it will take many appointments before the depression can be cured, or at least the symptoms of it. The appointments are a great way to improve the individual's self-esteem and confidence. Their moods will lift very quickly before they know it, and may even return to their normal self again. The feelings of inadequacy is a sure symptom of depression. If a woman in her late 30s cries, often during a job interview, and they have no idea why, then it is likely she has depression. Physically, her life is going very well for her. She has a husband and 4 children with great health. She and her family are also getting some great income. Yet this woman feels far away from her husband and her children. She does not like her job anywhere near as much as she used to. She often consumes alcohol when no one else is around. This is done to make herself numb. She goes to her treatment appointments. She discovers that she is actually feeling both ashamed and inadequate. She also feels guilty far more than what she should. This woman expects everything and everyone around her to be perfect. The good news is that after her therapy appointments, the woman realizes that this is very easy to quit her drinking. She was very comfortable to have a frank discussion with her husband and the therapist she is seeing. She is okay to discuss her fear and shame. The woman soon found herself feeling more positive and proactive. She felt as much closer to her husband and children again, and found herself beginning to enjoy work once more. Transitions and grief are 2 other depression symptoms worth knowing about. An old man in his 70s was so depressed that he often became delirious. He often yelled out his thoughts to no one. He found the thoughts extremely confusing. This just showed to him that he was not able to concentrate as well as he once used to. He had not participated in psychiatric therapy before, but his wife had noticed that he was appearing to be anxious and gloomy more often than normal. This was quite different to other times that he had showed depression symptoms. For much of the day and night, he found himself crying far more often than usual. He knew that he was due to retire from his much-loved job very soon. Another boss of the company he worked for many years would have taken over. Not only that, but this man also had a mother who had recently passed away. The therapy that he partakes in often usually pays attention to this grief. It also is designed to work out what life changes that may have occurred might have caused him to feel this way. The man had 9 therapy appointments. He can now control his beliefs and express them to other people very well. He can control any fears and discuss them comfortably with others. He has also learned how to communicate and talk properly and powerfully with his wife again. He loved his wife dearly and began to show affection to her once more. His therapist helped him to come up with a plan for him to move into the retirement stage of his life. Before he and his wife knew it, this man's depression soon began to disappear. He realised that he had hope ahead of him. He could be enthusiastic about his future retirement and knew that he could look forward to it very soon. The therapy sessions also allowed him to come up with a list of things that he and his wife could do when he retired. This helped him to become more enthusiastic and happy about this. It also gave him something to look forward to very soon. It is very important to realise that if we are showing depression symptoms, to never be afraid to get professional help and assistance. There are many professional, trained and qualified therapists who are more than happy to help. This is a fantastic option and thing to do, particularly if we would rather not show and share our feelings of depression to those who know us. Professional, trained and qualified therapists will always keep things confidential. They are not at risk of telling other people what is going on with you, as your family, friends and those who know you may very well do. Also understand that depression and the forms and symptoms of depression will be different for everybody. No age, gender or race will experience this condition in the same way. They will also experience it for different amounts of time as another person would. Some more, some less. It cannot be compared to another individual's experience of this. There are all kinds of things that can be done to help an individual manage their depression. There is no limit. Consider taking part in a mixture of different activities to help relieve this condition in you. Don't just keep to one. If we keep to one thing, we may find that it does not work at all. A mixture of activities will have a more powerful effect in helping an individual to recover from depression. When managing depression, there are a few mistakes that should be avoided. First of all, never ever tell yourself, or anyone else for that matter, to simply snap out of it. This will only result in a person to feel worse about themselves. It does not get cured with the click of a figure. Never keep your feelings to yourself. It is vital to tell someone or a couple of people how you feel. Not telling someone else will only cause you to bottle things up. Do not underestimate depression itself. Too many people will underestimate this condition and do not take it seriously enough. It is vital to understand what it is and how it affects your life and the life of those around you. Do not lose motivation for the treatment you are participating in. Losing motivation for the treatment you are participating in will only take much longer for you to heal. It may even cause other illnesses to arise, such as heart disease and diabetes. This is the last thing you want. You do not want to have to treat another condition within your body. Please also remember that it is important to be compassionate about yourself. Whilst it is easy to feel compassionate towards others, don't forget about yourself. It is important to admit that you are finding things hard, but know that it is perfectly understandable and okay to lower any expectations that you or others may have on yourself. Do not expect too much on you from others. We will all fail, but we can all pick ourselves up again. Finally, it is important to remember that depression is serious and it is an illness. It is an illness that is not always easy to manage. Our advice is to seek as much help and assistance and support as soon as you can. Do not put this off. The longer it is put off, the longer it will take to get better. Understand what it is that works for you and keep at it. if need be, as a friend, partner or relative to help keep you motivated and on track. When a person experiences depression, this condition can teach them to many different lessons that can and should be shared. Those with the depression have the opportunity to share their story with other people. It also allows them to make healthy and positive connections with other people. Those with depression will be able to find things in common with people easily. They will learn to become comfortable with their bodies. These people will learn how they can release their anger and release it in a more positive way. They will even know how to distract themselves from negative influence and people. These people have the courage to tell others of the things they have been through in life and not be afraid to be honest and open about it all. Nobody should wish depression on anybody, nor should we wish any other bad thing to happen to other people in their lives. Just remember that if you do have it, you will need to learn how to find a way to heal this condition. Don't let other people assume what works on them will work on you. You need something that you need will work on you. All of us are different and all of us will react to things and treatment differently. Keep in mind that depression can also occur in children. This might sound strange, but in fact it is not. Always look out for depression symptoms in them too, not just in yourself or in other adults you know. Those from other cultures are also just as able to get this condition. Please remember to keep an eye out for them too. It is a condition that can strike at any time, at any age. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast, which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course, when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.